let me present some webinar best practices that will be a successful conference and a webinar. So I would like to request everybody to mute their microphone. Only the speaker and me, moderator, will be seen on your screen. You might write your question. You may write your question at the chat box, and these questions will be entertained. And I will read these during the open forum at the end of Dr. Oñate's lecture. We are very lucky that we have an esteemed speaker to talk about these issues to all of us. She is no less than our medical director. She is a graduate of Cebu Institute of Medicine and awarded the most outstanding CIM alumni in 2016. She has a residency in psychiatry at the University of Michigan, Ann Arbor campus. Among her many accomplishments, she is a past president of the Philippine Psychiatric Association, Cebu Medical Society, the Philippine Society of Child and Adolescent Psychiatry, and the Philippine Federation of Psychiatry and Mental Health. She is an active consultant here in our institution, Perpetual Succor Hospital, and the Cebu Doctors Group of Companies. She is a mother, she has a wife, a mother, and a grandmother. And unknown to most of us, she is also a licensed NPC shortwave radio operator, she says. And her whole name is DY Doc. And during the pandemic and during the ECQ, she developed more of her skills in what they call cooking and gardening, she says. So without many other further ado, let me turn you over to our esteemed speaker, Dr. Pureza Trinidad Oñate. We will stop staring, Doctora, first. Doctora, are you there?
Yes.
Okay. We will turn your slides already, Doctor.
Okay, thank you. Okay, sige na, okay na. Okay, good morning, everyone. Actually, I am thankful that the Department of Internal Medicine thought of this lecture for our residents and the PSA health workers, because we really need the understanding of the mental health issues of the COVID pandemic. When the spread of the COVID-19 virus infection, I think it became synonymous with the term pandemic. Okay. And I think it scared the world for every one of us. You know, we were told that it started in the Huanan seafood market. And there were so many agencies who took time to educate us, to give us more knowledge. If everybody was taking it for granted, since there was a whistleblower from a doctor, by the way, who eventually died, who told us about the presence of this new virus. He died of COVID himself. DOH, WHO, the CDC, and others, some of our country's leaders, including Brazil, Italy, all others, US, were slow to recognize the seriousness of the outbreak. In fact, it included our beloved president as well. There was a failure to provide a clear-cut understanding of the virus. And of course, this has seeped through the different sectors of our society. At first, we did not take it as seriously as we should. Eventually, we realized that this is a very malignant virus. And we all got scared. Everyone got scared. There was a difficult line to walk between encouraging protective behaviors and the other end, excessive anxiety or panic as the public response. Some of us got so scared. I did. If you did not, then I did. I was scared about it. The insufficient preparation for the pandemic by the assigned or expected agencies is quite regrettable. Human coronavirus have long been considered inconsequential. At first, they just said, well, it's just another type of flu virus. They produce common cold and to the otherwise healthy individual. However, in the 21st century, two highly pathogenic human coronavirus, which are the severe acute respiratory syndrome coronavirus or SARS-CoV and the Middle East respiratory syndrome, which is called MERS, swiftly put the coronavirus in the limelight. The novel human coronavirus spread rapidly compared to MERS and SARS, due probably in part to the increased globalization and focus of the epidemic. And Wuhan, China. The timing also was quite bad because the outbreak was together with the lunar festival of the Chinese New Year. So there was a massive transiting in and transiting out of China. So the spread became very quick. There are a lot of international connecting flights because Wuhan is one of the business hubs of mainland China. The virus was able to perforate throughout China and eventually, of course, globally. In December of 2019, the COVID have caused serious illness. People were signed out for diagnosis only as pneumonia. And unfortunately, most of the earlier victims, and still are probably will be, are the elderly. And so they did not only have severe pneumonia, it eventually caused death. Unfortunately, due to the protean character and unpredictable mutation and versatile nature of this virus, it moved around like the art of the magic of the great Henry Houdini. If you have heard of him, he was a very known magician who could free himself even from the worst folded hands or even inside an aquarium or inside a swimming pool. Using basic common sense, okay, before we go there, since I think that this particular lecture would also be helping all of us go through what we call a debriefing process. Actually, what we mean by debriefing process is nothing very exotic. What it means is we journey through our feelings, what we had experienced about a traumatic event. Like when we went through the Typhoon Yolanda, we also did a lot of debriefing, not only personally, but also through video, audio video. You know, you woke, as I explained to you, do not say, oh, I have heard about these things. Remember your own feelings as you evolve in fighting the coronavirus. So in your paper right now, please write just, one minute. What was your reaction the first time you heard about the coronavirus pandemic? What was your response? Okay, were you the one who says, oh, it's just another flu virus? Or eventually you evolved into feeling scared? Okay, please write that down because you will go back to that later. And you write down how you reacted initially upon hearing of the end COVID-19 and as also as it evolved. We are all healthcare workers and we all are somehow in this profession because we want to serve others. But the outcome has really made us fear and worry about our own health and our fear for our loved ones, whether they are near or far. Will we be responsible of bringing the virus to our respective homes? We will have, I personally had experienced changes in sleep patterns. Not so much with eating. I was fine with eating. It was just the sleeping. It takes me longer than the usual 10 o'clock sleeping time. There is difficulty also in concentrating. Worsening of chronic health problems. Unfortunately, for those who may have lung, heart, diabetes, hypertension, health problems, they are usually the target comorbidities of this virus. Of course, the worsening of mental health conditions for our brothers and sisters who are known to react with depression, anxiety, or they may have an existing more serious illness like bipolar and, of course, the schizophrenics. They will worsen under the COVID pandemic. They will have a lot of thoughts that will be unanswered, or probably they are trying to answer themselves in the wrong way. There will be increase of substance abuse like the use of alcohol, tobacco, or other drugs. Our initial response is we were taught about hygienic practices. We were told to avoid close contact with people who are sick, avoid touching our eyes, nose, and mouth, practice social distancing by putting space between ourselves and others, and we have to wash hands with soap and water for at least 20 seconds. We are lucky that Sister Gaudilia started putting up some, even long before the COVID. She was putting some alcohol spray along the corridors in the nurses' station, and some people have probably made use of that more often. Patients with COVID have reportedly had mild to severe respiratory illness. As earlier said, symptoms can include fever, cough, shortness of breath. And please note that symptoms may appear 2 to 14 days after exposure. That's why the most dangerous people as of now are those who are asymptomatic but already have the COVID virus within their system. We are advised to seek medical advice if we develop symptoms and have been in close contact with persons known to have COVID, or if you live in or have recently been in an area with ongoing spread of COVID-19. Thank you to our infectious committee led by Dr. Mercedes Mujeres, and of course, Bebot Sarcauga, Shua really helped us in our preparation, the triads, all the other plannings, and of course, the entire committee. And Sister Zeta and myself are very thankful to them for that work that they have done tremendously well. And we were worried about PPE. So we started worrying about masks, gloves, and alcohol, all these things, like other disinfectants. Even our faucets in every nursing station were changed to something more, I forgot the name of it, but you can just close it with your elbow. Okay. Medical health workers during the COVID epidemic have high prevalence of the following rates and risk factors. Severe insomnia. When we say severe insomnia, it's either early insomnia, which means you cannot go to sleep. Or that could be a late insomnia, meaning you sleep later. Or it could be a middle insomnia, where you sleep in the middle and wake up early. You wake up in the middle of your sleep. That's what we call middle insomnia. It is only called insomnia if you are not able to sleep and remain not able to return to sleep within an hour. An hour that you cannot start going to sleep, and then if ever you doze off, it will not last for an hour. Then you have insomnia. And of course, when you wake up, you will feel very tired. Anxiety and depression is common. Of course, there will be sadness, there will be fear and worry. But they become beyond what is normal when they interfere with your daily functioning. Maski nahadlok ka, pero makatrabaho gihapon ka. Or nag-uol ka, doon na kay atubangon, nambuhat ra gihapon nimo. But if this interfere in your daily activities, then there is really indeed a pathological signs of anxiety and depression. Somatization is having many bodily symptoms. Sakit tiyan, sakit o, kasukaon. Tato pa, your body is responding to a psychological stress by the physical symptoms. Obsessive compulsive symptoms are, the obsession are the thoughts that are beyond your control, that are repeated. No matter what you say, I will not think of it, it still continues to haunt you. Balik-balik. Compulsion is behavior. So, some of you may be so scared that you take longer than 20 seconds in washing your hands, and you do it more repeatedly than what is required. No? Compulsion, dili ka kaundang og sa imong gustong buhaton. Kanang mga compulsive nga moabli sa pultahan, unya mo, balik na sad kay manghunaw. Unya ikaw maghunaw, uy, ang kuan sa gripo, wa man ako makuan. Imo na po itong limpyuhan ang gripo. So you, obsession, compulsion is thought and actions that are repeated, which are beyond your normal control. Okay? Sunod na kuan man diri no ang sad mo. Next slide. Diri. Okay. What were the initial coping skills? You know, immediately, I'm very happy that our residents, our alumni, our consultants, of course, our different committees started a coronavirus conversation. This is very important. Unknown to you, I was monitoring 4 chat rooms for PSAs. And I noticed that through along the way, we have to learn new jargon, such as PUI, PUM, and so forth. You check routinely what are new development among our colleagues. And we see not only are limiting ourselves to perpetual soccer, we started to ask about local, national, and international news. This is my take on you in terms of getting knowledge. Awareness and knowledge can be power, but we must balance facts and feelings. Meaning, we only have to look at the websites that we know are really good. Meaning they are really have the right evidence when they talk about something. Dili ka magpadana ng rumor mongering. And of course, when we became so sad about it, we should not continue watching for long. I will tell you later how to moderate your watching news. Okay? Many of us would like to comfort ourselves by having a mantra. Moagi ra ni, this too shall pass. Sige kita balik-balik, ana. Kana okay ra na. Kay that is a hopeful mantra. But the problem is, when will it pass? And that is still the very same thing that bothers, if not all of us, most of us. Because nobody knows when will school return, when will the ECQ be lifted, all other questions that has remained unanswered. Then we go into progression of our coping skills. Okay? We take breaks from watching. We must take breaks from watching, reading, or listening to the new stories, including social media. Hearing about the pandemic repeatedly can be upsetting. There was a recommendation that we should only take a look at it not more than 2 hours a day. Some of us are really glued to our TV, our computer, our cell phones, and what have you of the new gadgets. But more importantly, we have to take care of ourselves. We have to know how to do relaxation techniques. And as simple as taking deep breaths and doing some stretching, and then also meditating. Of course, this will take another lecture to help you all these things. But if you want, it's very easy. You look at YouTube, there are a lot of meditation techniques and easy to follow. Please look at them. And then second is you try to eat healthy, well-balanced meals. Magmantay ta, ug unsay atong gikaon. We should take more vegetables, eat more fruits, lessen our carbo. Of course, never forget our protein, but we have to eat healthy. We have to exercise regularly. And exercising regularly, mingon ang mga nurses, saan mo na mo pag-exercise, Doc, naman, just walking back and forth from patient's room to you, that's already an exercise. A total of 15 to 30 minutes a day is what is only required for every person. And with exercise, you produce more endorphin, and you will be having lesser problem in getting plenty of sleep, which you all need. Naipag-ingnon, mas maayo pa, eksakto imong tuog, kay kung eksakto ang imong tuog, eksakto sa imong gana sa kaon. Okay? You have to avoid alcohol, caffeine, drugs that are more stimulating. Don't drink stimulant drinks. Okay? Take time to unwind. Sa una, sayon kayo, kay gikan ta sa atong clinic, gikan sa atong office, hapit lang ta sa Ayala, hapit ta sa SM. Unfortunately, these are not all available. But there are other things that you can unwind with. For example, develop your own likes. Like, if you want to do some origami, you want to do some drawing, all these things will return to you. Just as was mentioned by Arnold, I am back now to my gardening. Huh? Try to do some other activities that you enjoy because this will help you unwind. Dili magdugay. Unya, dili magpabilin sa inyong hunahuna ka ng problema kay malingaw naman ka. Do not do something that you don't take pleasure with. Ako, I still play games in the internet or games on my computer. You look at the games that you like. Ako sa simple bubbles, kanang pabuto-butos bubbles, kailangan color, malingaw ra po ko. Or I do words, no? Then, last but not the least, you have to connect with others, especially people you trust, about your concerns and how you are feeling. And I think Sister Seta can attest to that I sometimes talk with her. I unload what are my concerns to her also with regards our hospital. And of course, sometimes my own personal things. There's nothing wrong because you have to trust each other. You can tell anyone and anyone that you trust. Okay, that will not put you in hard waters. Okay, 6 steps during the quarantine. What you to do? Okay, just as earlier said, I said you download meditation apps. They are free. They are free. Ayaw bayad, naay bayad sad. Pero naay daghan kayong libre, away bayad. Okay. Have video check-ins with high vibe people. Ayaw mo pag-check-in na ng mga depressive sad nga mga amiga ninyo or amigo ninyo. Kaya mauban mo depress, mabira mo. Kanang wala insultihan kundi makalisang, makahadlok, makagool. No, don't connect with them. Once in a while lang, kung sila mo connect nimo, okay, pero don't go out of your way to connect with them. Okay? Then, as I have earlier said, you turn off the news for a little while. Tanan yung news channel, main talk is always the COVID virus. Okay. You have to get some fresh air. Yung asa man may mag-fresh air. Ang dakang fresh air, gawas lang mo sa inyo gamay. Ginhawa mo. Kaya, breathing in, breathing out, and then put yourself in a relaxed situation, a relaxed position. You sit down on a comfortable chair, put your feet on the ground, or you can even just have this kind of yoga position. Okay? Move your body. In YouTube, there are a lot of exercises. Even for me, who is a senior, there are senior exercises good for my age. I look for those. I do Zumba, and it's happy because there's a nice music in it. Bago niya, gusto mo ka ng disco, mas maina kay why magbuot ninyo kung saan yung pagsayaw. Okay? And the one I said that you have to do creative projects. I like painting. I am back to my painting, and I have an art box that I bought from the US. I open it again and look at my different colors, using pastel, using watercolors, using acrylic. Whatever you like, do something creative. Ngayon ka, di man ko creative, Dok. Kanang creativity doesn't mean that you have to start from nothing. You may look for what interests you, and that is what you're gonna do. Okay? So look at it. What do you want to do? Dagkay recommendation. Ayaw gid mo pag-ingon wa ko'y buhaton. Ang kanindot lang gyud ug dunay unta kay connection sa internet kay mao may daghang mabuhat. Okay? Pero di gani, madto kasi imong amiga nga dunay internet or dinhi sa hospital, you just download. Okay? Even the games you can download. You don't have need of internet. Okay. Use understandable ways to share messages with people with intellectual, cognitive, and psychosocial disabilities. In other words, there are people who are not as bright as you, who do not have the ability to analyze as you, and has kanang mga psychosocial kuan bitaw kanang disabilities di kayo ganahan makig-istorya sa uban, tabangan sa na nimo usahay. Pero ug mo kuan na gani akong ako ingon ninyo nga if they bring you down, you better tell them, let's be more positive about things, okay? The forms of communication that do not rely solely on written information should also be utilized. So those who are team leaders or manager in a health facility, dili lang nang sota nimo, tagab nimo, ana. You have to talk to them, okay? Not just written. As we say, different folks needs different strokes. Some will need more formal treatment with their anxiety and depression. Only will you need that, as I said, if it interferes your daily functioning. Others will become healthier because they will become more motivated, they will have more interest, they will have a lot of things to do other than what they used to do. But there are others who will be in a different situation, meaning they will be vacillating between being really feeling bad and doing something positive. So different folks need different strokes, and I will further explain what I mean. Here are the different reactions. If you are working with the ICU or witness dying and death, you are in ground zero. This is the most difficult thing. If you lose a loved one, you are hit by a tsunami. Believe you me, there's nothing as bad as when seeing someone die of COVID. I have experienced that myself. You know, I really, that the first thing that hit me so badly, the death that felt hit me so badly was the death of Dennis Tudtud. He was a very good friend. But it's not the place for me to discuss how I felt. But I can tell you, I also felt the same way. I could have my tsunami too. So there's nothing wrong about these feelings. The thing is, you try to acknowledge it, that it exists. And if you need to talk to someone, please do. And if you need professional help, please ask. If there is a possibility that you lose your job or you will face a financial bind, that is also another way of coping. Na hinahinay, you know, I have many patients who do telepsychiatry with me. And one patient, uh, you know, is having a very hard financial bind that he thought of committing suicide because what he was losing was millions, not just hundreds. You know, I talked to him. I said, dili na mao ni atong buhaton. Di ko kaybaw sa imong negosyo, pero this is how you should cope with it. So financial bind is a problem of those who have big money and those who have little money. That's a reality for the present situation. Of course, as earlier said, if there is a pre-existing psychiatric history, that could worsen. Whenever they call me, you know, I have very good memory, thank God, of patients of mine that I know have pre-existing psychiatric history. I really immediately talk to them at length so that they could either pick up a prescription through email or a prescription by going to the guardhouse of where I live and pick it up from there. And of course, the next thing is your constitutional or genetic vulnerability that could weaken you. Huh? So, kung ikaw daan ka ng kuan, ka ng daot, di pagkamukaon, problema yun na. Diet ka, problema na. Kay kuwang man imong nutrition or genetic vulnerability, kaliwat, na ato. Problema po na. Okay? Listen to this. Doctors and nurses revealed to Time magazine recently, meaning in less than a month ago, that they harbor dark feelings owing to fears of spreading the disease to families, frustration about a lack of adequate protective gear, exhaustion, and deep sadness for dying patients. And I think all of us can identify with that. You know? So, when someone in the family dies, and we sometimes feel very guilty that we were not there, or guilty that we may have infected them. And then, of course, the present lack of adequate protective gear. Daghang kayong klase nga PPE. So, maglibog tag kung saan pagpili. Maskin lang gani ng inyong ang atong mga kanang chats, nahimuot ko, kay lain-lain ang hunahuna kani maayo ni, ang usapod kay maayo ni. Okay? And of course, having seen some morbidities in our patients is a very bad experience. Eventually, in the midst of this global pandemic, people are talking about the urgent and critical need for, as earlier said, PPE. Kamo, kada usa ninyo, pagbilin yun mo, usa ka set sa inyong PPE, ayaw hutdan nyo gamit. Kay og na emergency na kay mapunit. Ayaw mo gingon nga basig dili, basig kan. Pagkuan kay that to be forewarned is to be forearmed. Lack of respirators is a problem. The need for testing. You should know what is the difference between the different testings. No? You should know what to recommend to your patients. Encourage people to flatten the curve through social distancing. Kanang daghang kayong daghan man, if you look at the internet, daghang kayong mga clip art nga stay home, we are working for you, or something like that. But I just have read 2 days ago in the internet that this, if you notice, like yesterday, there was a group of airplanes that flew around New York City to honor the frontliners. And there were songs honoring the frontliners. Yes, thank you very much for thinking of us. But to the frontliners, I would like to share with you a nice observation of the writer. He said, sometimes we frontliners, because we are shown the gratitude of people, sometimes are sucked into doing more than what we could. No, you take care of yourself first. Ayaw mo pag-ingon nga, frontliner man ko, magpakamatay ko. No. Usar yung kakabuok ay. Take care of yourself. Very, very important. Me first before others. Kay wa na kay mabuhat kung 6 feet under the ground ka. Always take care of yourself. I ask you to take care of yourself. And when you pray and asking for blessings, first yun, ikaw mingon ka nga, Lord, you cover me with your grace nga dili ko affected. And going back to our own spirituality during this time, I have never found myself as I did when I was yet in college, early on in my life, when I used to go to daily mass. Kana nawa na, pagka-doktor na ko, daghan na kayong mga buhaton, hastang ako, I only go to Sundays and holidays, and in between, maybe Wednesday or a Friday, but not as regular during weekdays. Pero karon, kay wa may laing buhat, the first thing I do when I open, I look at the mass for today. That would be very good because it reminds us, of our being loved by God. Actually, if you look at the Holy Mass, it's really an expression. The Eucharist is the Eucharist is an expression of God's love to us. But only minimal reference. We are all talking about physical and any other things to help ourselves. But it has been noted that the potential mental health crisis has not been answered. Karon nagsugod na, kaya nakita naman nila. But that should be given a big priority, mental health. Most families are going through the full gamut of emotions right now. Worry, fear. Some will have gratitude, some will have love, others will have compassion, but there will be frustration and restlessness. There is a fragile, kaleidoscopic emotions, a fluctuating pattern of colors that changes radically within the slightest nudge. Mag-ilis-ilis ang atong debate. Among us who are raised by parents who saw talking about emotions as waste of time, self-indulgent, and as a sign of weakness, kung magstorya tag atong problema, and shameful, actually, this is an emotionally dismissive response. And don't ever do it among your children and other family members. Do not think that any complaints is just to be dismissed. Paminawa, kanawag, unsaon ninyo pagtubag. Ayaw, pag taasa kayo, kay ingon man ako ninyo nga dili mo kadaan na. Okay. Parents who understood the importance of expressing one's emotion for good mental health, or for bonding, for learning, and for building resiliences, they are what we call the emotional coaches of their children. Psychiatrists and psychologists and neuroscientists have found that children who grow up with parents who use emotional coaching have calmer nervous system, a lower resting heart rate, a healthier emotional brain circuitry, and better coping skills. These are the kids who stay cool under pressure. Kitang nagtrabaho, kitang mga doktor, ibalik nato sa atong mga
Emotional
tatay.
coaching.
We think that when we go back home, we would like our children to adapt to us. No. We have to remember that they also are too young to understand that what we are going through. Maybe we could spend a little time and to let them understand na kapoy kay ko dong, kay mauni, pero listen to them too. Huh? Emotional coaching is very important. Dong, nakuha na sa dong ni freeze na sa. Next slide. Okay. So we have to see mental health on a spectrum where there is health and well-being on one end and the illness on another. There is always a balancing act between health and illness, and we all need support. I would like to share this. I do not know how clear it can be seen in your screen, but it really is a very nice slide. It's the benefits of gratitude. What are the benefits of gratitude? When we are thankful in our heart, the benefit emotionally, personality-wise, health, career, and social. Personality-wise, if we have a sense of gratitude, we are less materialistic, less self-centered. We look at other people's needs as well. We are more optimistic. We increase self-esteem and more spiritual. And if emotionally we are grateful, you will have good feelings. You are not likely to have bad vibes. More relaxed, more resilient, less envious, and happier memories. And if you have a good social sense of gratitude, you really connect to other people. You are more social, you are healthy, you have healthier marriage, you have kinder attitude towards others, you will notice that you have more friendships. If you are the kind of person, you are a doctor, a nurse, or anybody you know that are working, you will notice that if your friendships do not just limit to those who you work with, you have a kaleidoscope of friendship. You have friendships from church, you have friendship from kanang kuyog-kuyog ni mo kaon, you have friendship kuyog-kuyog ni mo adto sa simbahan, whatever. Lain-lain nga klase nga friendship. Okay? Now, in your health, you will have improved sleep. Okay? Happy ka man. You have less sickness, you live a longer life, and ang imong now, relax kayo. You will have increased energy, and you have more time to exercise. Muna nga, kanang uban yung di ko mo exercise, kay kapoy kaayo, anak. Maugi nang kinahanglan mag-exercise. If you feel so tired and out of gun, because as you exercise, as I said, endorphin will increase, and you will have your happy hormone concentration in your body high. In your career, you will have better management. You will have an improved networking. You are goal achievement, and you improve decision making and increase productivity. So, if you are a grateful person, happiness is just within the tips of your fingers. Easier said than done, though. But there is a technique to do that. Okay. Now, I would just like to go through, because we are opening very quickly. These are the last two slides. What are we going to do since we are going to return to work? We are planning to, many of us are planning to return to work. And what are our concerns? The individualized approach is that the time to think beyond one size fits all. Meaning, dili tatanan will have the same way of handling things. It will be depending on what our need. When you are going to reformat your offices for the doctors, you see what your needs are. Dili ka mo copy sa uban kay dili siguro na mo kuan sa imo, di mo fit sa imo. You know, your approaches to how employees work also is required. Remember that your secretaries are also very tired and also are subjected to feelings that we are feeling. You tell them how to do things, even if there had been a training done. Maybe your own way of doing it in the office is different from the others. O gusto nyo no, importante man yun na, no mask, no entry. Employees returning to the workplace may need new approaches to routines that they have lost. Supervisors play a role in helping staff structure their day. So the supervisors of each department also have to think creatively what to do within their purview of responsibility. Employers and leaders can get a tone that emphasizes concern for employees' well-being by offering compassion, honesty, and openness. Kung magtudlo mo, inyong mga kauban nga, dili ni namo kasaba o dili kanang among tudlo lang ninyo para po ni sa imong kaayuhan. No? It's the manner of how we communicate. And we have to communicate consistently. Remember to reduce our employees' uncertainty and build emotional support. Build emotional support. Up. Everyone is coping with high levels of uncertainty. Their personal, professional, and financial future. We all need support for our emotional and mental well-being. We likely face new concerns, stressors, and demands brought on by a return to office life. And of course, all our patients we should require by appointment only so that they can be pre-screened. Assess the health of the patient and whether their occupation will put them in line that they are, if possible, COVID patient, what kind of work they have. Health status or behaviors put them at heightened risk of contracting the virus, then spreading it through that in-person visit is most likely. I would like to end with this note.
Thank you very much, Dr. Onyate.
Please take
Thank you very much, Doc.
Okay, you're welcome.
For the very comprehensive and very helpful tips and lecture, Doctor. We surely appreciate it. So may we remind all our participants, you can actually ask questions at the chat box. I will be able to read this to Doctora for her to answer some questions.
Thank you.
I will share a slide. I will share slides, Joel.
Okay.
Yeah, we will be sharing also the slides of the research or the survey that we did with one of the residents, Dr. Elray Inoshan. So these are actually the survey of our healthcare workers in Perpetual Support Hospital. So while we be preparing the slides, Doctora, I would ask you some of the questions that are in the chat box.
Okay.
Doc, the social distancing or no physical contact, hugging, social isolation contribute to person's mental health. And some people react differently. Some might be able to cope better than the others. What are some elements of the people that do not actually make it easier for them to cope with this? And what is your advice?
People who may have difficulty in social distancing will include me because, I'm a very person-oriented individual. I really like to hug, but I have to remind myself that at this particular time, I am not only protecting myself, but I am also protecting the other person. So, ang sense of otherness is very important. Sense of otherness. If you don't think of the other person, then you go on. Pero karon required man yun ang social distancing. And it has been proven by evidence that it is really very helpful.
Yes. Okay. Doctora, the use of social media, no, sometimes it contributes to anxiety. And even if it can be also good, when is it bad for us to have those social media and limit it? And when is it better for us?
When we use the social media, we try also to be self-reflective. What is the result of this posting? Is it making me a better person? If it's not making you a better person, don't go back to that site, no, to that whoever friend you are. And if it is helping you, you can visit it. But as I have said, you minimize the number of hours spending time in social media. Ang kanang nagsulti, importante kayo na ug ang source. Ang source, whenever you see anything, you don't end up just reading. No? For those who are not so network savvy, ikita ninyo na amang yun na kanang kinsay author, kinsay kon, inyo po nang i-appeal sa inyong Google o kinsa nang author kay ug wa na siya background nga nung maminaw man ta nila.
Yes, that's true.
Important.
It can be two ways, no?
Yes,
it can help.
It can be helpful or it can pull you down.
Okay, there's a question in the chat box, Doctora. How to deal with guilt when someone blames you when other household members are infected? So they blame you of them being infected. Yes. How do you deal with this guilt?
That's kind of difficult, no? Kay kinahanglan sa naghapon o ikaw mismo, huna-huna ka, have you taken enough precautions? But if you have not taken enough precaution, you have to change your way of doing it. Kay abinin mo, all of us, one way or another, magda dito sa COVID sa balay. Na amang yung necessary way of doing it. No? Like kanang shower before going home. And then when you arrive home, you should have a basin that is containing disinfectants where you will put your shoes. And then, humana kag kaligo hapyo, butang yung shoes. Ang imo, wa kay nga gikan sa hospital. Pero lisod ng guilt kay ang guilt will evolve into depression. You tell yourself at that time when you were not really very careful, maybe because you did not know any better. In the beginning, we did not know any better how much precaution we take. Pero nasultihan ka na, nyawa ni mo buhata, mong pisal siguro kaspare. Sultihan naman ka. Pero remember, most of us did not know any better in the beginning.
Yes. Another question, Doc. No? I think our residents and nurses and paramedical assigned to COVID patients, you said they are actually in the ground zero. Yes. So they may have the highest chance of getting anxiety, having to face the some risk of day per day. Sometimes they say they deal with what we call post-traumatic stress disorder, especially if they see something that is traumatic from them. And then there is about somatization. Someone questioned here is, I think we experience it often when we are assigned in the emergency room and encounter patients who are asymptomatic. How do we get rid of this additional stress? So they have this somatization.
Well, if it is somatization, meaning it is they are experiencing physical symptoms, right?
Yes.
Physical symptoms. Wag na after, like for example, tuo kang hilanat ka, why ka ng temperature. Ang temperature okay ra, normal ra. You try to get the evidence of what you are feeling. Ang rule of thumb is only say it is somatization if all the evidence has been visited, and you can say that you are just healing it without really basically physical reason. Kana mang why actual body changes. So if you experience this, makahibaw ka nga nagsomatization na ka. Or kung nahibaw ka nga, murag kasukaong ka pirmi, na ako naman yung kadlok siguro. One of the reasons why there is anxiety in the present time is because lack of control. We have, as a human being, we are rational, right? We are better than the animals. So we think that we can put things in order as much as possible, which is true that we could because we are higher human beings. But this COVID has placed us in a very delicate situation because of its protean nature. That's why I emphasize that the evolvement of the symptoms and the behavior of the virus is very unpredictable. So, mana na, mo recall ka, mo balik ka, o kanang man kung anong, you talk to someone. And if need be, get professional help. Kung pirmi na lang kang ma-anxious, na tanan mong makitaan, mahadlok ka. At in the beginning, mahadlok man ko man is perpetual soccer. Pero kung di ko mo adto, samahin mo, bagod na. Oh. So, it's just the first try. That is important.
English siya makita. Okay. Sorry.
By the way, for those who are working in perpetual soccer, you can contact me, but you have to write down in the text that you are from Perpetual Soccer Hospital and what kind of job you are working. You can contact me at 0922-856-1917 because that is my professional phone number that I usually do not miss to answer. But at times, if you cannot contact me there, my home phone number is 0. No, not 0. 310. 310-590 ba to? Diba? Nakalimot ko sa home number. Dito nasa directory.
Nasa directory. Probably we can Google that. No?
Yeah.
Doctora, there is a question here. No? Good morning. How can you reconcile the feeling of guilt of not doing enough for someone or patient, at the same time not trying to protect yourself? No? I know we could have done more if we tried harder, but it's not enough. That I did my job as a doctor. So much death, and sometimes I feel bad of their family members. Thank you.
Okay. It goes back to the same slide that I said, that you are far more important than anybody else. When you say that you have not done enough, would enough put you in the line of more infection or possibility of dying? So, it's important to take care of yourself. I don't think God will get angry at you. You can only do so much. Unya, ang kanang I could have done more is always a hindsight. Remember that. It's a hindsight. Because if you, most are a hindsight. Kung dili na hindsight, you have to ask yourself, kung panangilitan, this is the worst case, no? Iba ako pa itong mouth to mouth, na boy, ang tato, sa mouth to mouth ni mo, niya ikaw matay. Diyos, ikaw may mo. So, as I said, ako muna bago bayan. Because your life can still be used by many lives. You can still save so many lives. Not only for your family, but for your patients as well. Muna, by the way, akong doon di ko isulti ninyo, nga naay ni gawa sa kaneng kuan sa katubitang magsigig pakpak mga tao, magsigig pray sa frontliners. Doon ay niingon nga sobrahan ra pod na kaayo nga mas push bitaw ang mga frontliners to do beyond their effort. So there is do not sila criticism nga do not do that so much, or they were warning frontliners, do not feel obliged that you have to do more than what you can do just because makpak ra ba ni sila, naghimo sila kanta, gibuhat sa para sa mga frontliners. Figure. Ako, I believe the same thing.
Ni hang. Ni hang siya.
Nihang dyan.
Ihang gamay, Doc.
Kinanglan yun, importante ito kakaayo. Always remember that. Stable ang internet connection.
Okay. Doctora? Yeah. We know that anxiety may be a good way of coping with some uncertainties. No, it pushes us to be cautious, right?
Yes.
So, and it is not always bad. It is not always
that's
bad.
true. It's only bad when it interferes with your functioning.
Yes. Now, Doc, sometimes when we feel anxious, you give us those coping mechanisms. We go to persons go to their loved ones, to their family for support. When is it a point that anxiety needs medical attention? I mean, that we need to have already a medical consult.
When you need treatment.
Yeah.
Well,
yes, we need treatment.
Kung di nakakatog, doon na kay mga symptoms because they say that anxiety and depression are side by side. When you have depression, most likely it started as anxiety. And if you are anxious, it will go back to depression. It will go forward to depression. In anxiety, if you cannot sleep, you cannot eat, and you don't seem to be happy with what you're doing, those are the telltale signs that you are very anxious, that you don't look forward to going to your work. Well, some of us still do not look forward to doing our work, but then when we try to think about it, ningon mantana, we probably are still needed there. Can do this, I can do that. We talk to ourselves. We try to see what we can do. Pero kung maabot na ng panahon na we just stay and not go outside, that is very bad. That is really very paralyzing anxiety. You need help.
When they need to have medical attention, Doctora, you said you practice telemedicine. Is it?
Yes.
Does all the psychiatrists also do this?
Yes.
And then they can be reached through this, no?
Yes. I even placed that in Sister Zeta did also. I placed that in our chat room. I think sa task force. There are even like the Philippine Mental Health Association of Cebu are also giving advices about batugwa na ako tatong gibutang diri. Advices on how to contact them because we have people in the PMHA who are just standing by and they gave the number.
Yes.
And then they can opt whether they will see you by audio video or just through the phone. There are helplines, in other words, helplines.
Thank you, Doctor. Another thing, Doc, how does a person tell his family if he or she patient that is COVID positive, tell your family without causing problems or probably worries from the family members?
How to tell a family member who is COVID positive?
Yes, the COVID positive is the patient, and then the patient wanted to tell his family about that he is a COVID positive without causing anxiety to the family members.
Well, first and foremost of all, the doctor should know how serious it is and what is the prognosis of the case. Because we have to be as honest as possible as we could. But we could say things in a manner not so alarming. For example, di na ito na una nagsulti nga, sus mamatay ra ba ni siya ani? And that kind of information will probably just put everybody, in great sorrow. So you have to practice how to say it to the family. Kung ikaw, you are known to be so blunt, you better ask somebody to help you talk to the family, how to talk to them. Kana, how to talk to them, gikan sa imo. Ang ikaduha, kinsa imong sultihan sa pamilya, na kalma, nga makakasabot, nga makahatag sa information ngadto sa uban. Ayaw pagsulti sa tanan, nga ugwa pa kay kakaila, ila-ilaha usa. I mean, like 10 minutes could tell you whether the person is anxious or ready to accept your diagnosis, no? Pero ang kana gyud kuan gyud hanay gyud tanan. Mao ning nahitabo ana nya mao ni among nakita sa X-ray, mao ni ang iyang COVID testing ana kuan. Pero sa katapusan depende sa situation sa patient. Kung grabe na gyud kaayong pasyente, di gyud ka moingon nga kuan lang ta mga G lang ta okay ra ni magkuan na. Well, okay man ang mga G, no? Pero kanay og bati na gyud kayo mayon nga well we will do everything we can as reassuring kay na sa pasyente sa pamilya we will do everything we can that is available to us to make your patient be very comfortable and hopefully we could arrest the progress of COVID.
True. It's the same thing with all the rest of our patients, right?
Yes.
When we try to give the bad news, we
Correct.
also give the certain options or probably the what we can do. Give hope, but not the false hope, right? So another doctora, there is a question here. Hi doc, we're reading reports of suicides from healthcare workers abroad, but we are not seeing this problem here in the Philippines. Do we as Filipinos have better coping mechanism compared to other races? Or is there any factor why we appear to be resilient, perhaps genetic or cultural factor? No. Hello, Doctora?
Dili ka kabati? Can you hear me?
Yeah, and then naghang lang ka, Doctora, ganina.
Okay.
So you heard the question, Doctora, no?
Yes, I heard the question. The Filipinos are gifted with the ties, social ties, no? Family, social ties. So, naay maistoryahan. Na ikaduha, kadaghanan sa tuo Ginoo. Tuo Ginoo. You know, faith is a very strong factor in people who kill themselves because they do not believe that, you know, life after other things. You know? Ang ikatulo is, ang kanang sa abroad, usually is because if you have I read the story of that doctor 41-year-old female doctor in New York whose father was a doctor also who killed herself. She was really showing signs of depression which the family apparently just did not see. Kanang kuha man to siya kay siya ra man gutong usa. The father lives in another place. Iyang papa usa pod siya. And he did not I suppose she did not want to burden the father because the father is a retired doctor. And I think, tiguang na, 80 naman siguro to, wa po niya isultihi. Kana mga ingon anak, di na mahitabo sa Pilipino. Ang Pilipino, kadaghanan sa ato, makikistorya man yun. Pero we have suicides. There was one suicide, I think, in Manila from one doctor, if I remember right, one resident.
Okay.
Pero possible na ang suicide, pero dili kay daghan sa Pilipinas, mas daghan abroad. Nya na sa uban nga they kill themselves ahead because they know how it would be like towards the end of COVID. I mean, towards the kanang end of the disease ba. They will be intubated. So even before intubation, they kill themselves. Sa kanang mga abroad. So it's an information that is really, it's good if you are having those thoughts to discuss with another doctor because for all you know, you are thinking you are beyond help. But there are still so many things that can be done. Secondly, it's not within us to decide when to kill or when to die. Just as we did not decide when to come to this world. It's not our call.
So when that happens, you need medical attention.
Definitely.
You should acknowledge.
Yes. Well, we psychiatrists, we always take it seriously when a patient says, I would like to kill myself. That patient I told you who was losing millions really did not tell me that he was going to kill himself. He was driving on his very nice car when he called me. Kaya nag-audio video man ni. Ako siyang ginan. Ako din siya gidiretso kay kaila naman ko niya. Tingko, apel gini si mo huna-huna no nga mas may pag maundang tanan kay wa na kay ko anon sa imo huna-hunaon sa imong obligasyon. Unya, tinuod yun na, Doc. You know, whenever you are able to tell the patient that you know that they are suicidal, it gets the burden out of their system and they will start talking. Dili na sayop nang huna-huna nga if you talk about suicide with a suicidal patient, you are adding the patient's desire to kill themselves. To the contrary. So kung kayo siya, pag-ingon ako niya nga, you know, what you need, I think, is you have to take this medication. You have to take antidepressants, take anti-anxiety. Diretso na yun siya, ingon siya. Kano sa man ako ma-pick up ang kuando. Nausab ang iyang kuambay. Tsaka sa ako ma-pick up, nahadlok siya nga di namin magkita. Nga, kaya tungod, lagi na yung quarantine. Inko, no, you can pick up your pan. Why 20 minutes? Abot sa kanang akong balay. Ngayo, sa nalipay ko. Kanang ngayo man sa prescription, that means nga, he's willing to go ahead. Ayaw na dong sos. Kadaghan na ng mga tao nga zero. Na zero yun. Pero kay gikan man sila sa nakakita. Ikaw, wa man ka magikan og zero. Nakaibaw man ka nga kamao ka mangitag kwarta. So I told him, tawag ako ha, tagay kog update. And I also prayed for him. I always pray for my patients, especially kanang mga suicidal. I pray for them that there will be light in their minds. They will think.
Thank you. That's very encouraging, Doctora. For example, our residents or probably our healthcare worker would see some of their co-worker having some severe anxiety or disorder, and then that needs practically help. What would you advise to these residents? Where will they tell these things?
Let us talk about stigmatization of psychiatry briefly. Kadaghanan sa dagunahuna, kag magkita kag psychiatrist, ang requirement buang ka. Sayop na. You use psychiatry when you can still do something about yourself. Kay buang bago ng psychiatrist makigsulti nimo nga di ka kasabot. Ha? Okay, ikaduha. Seeing a psychiatrist does not mean nga you will be like that the rest of your life. Karon, depression is very, very treatable. Anxiety it is not completely treatable or curable. It's treatable but not curable. But na ay daghan kay nimong makita. And then makita nga tambal. And you know, there is an array of choices for psychiatrists. Depende sa psychiatrist. You know, we psychiatrists, we should not, I tell my young psychiatrists, do not impose on the patient what medication would work. Always ask the patient. And what you say is, eksakto ba, enough time ba nimo nahatag? Have you given it at least a try for 1 week? Pero sa depression, you should try it for 2 weeks or 1 month. Dili na mawa dayon, but there is improvement of symptoms. There is how to monitor the patient. So ayaw, dili, ang kanang resident, kakita sila dunay na ikinanglan, ayaw ipaagi komedya. Kaya usahay ko ipaagi magkomedya sa mga doktor because the doctors are also stigmatized themselves in sending their patients to the psychiatrist. What they would say is, bay, nanangana man na imong ikuan, imong gibati, you listen first before just saying, just dismissing, even if you already saw the co-workers' behavior in the ward, do not just say, go see psychiatrist, go see Doktora Unyante. Parera ko na sa mga madre nga sa una, yung pagtuon sa ako, wapa ba ako mabuang, ano mo ko dito? No, you know, that's even true. Pari, I see priests, yeah. I'm even seeing 2 bishops who do not belong to the Cebu diocese, but I'm seeing 2 bishops. But di man na abnormal nga mo adto kag psychiatrist kitungod na. That should not be stigmatized.
True. That's a good thing, no, Doctora? People should not think that if you're seeing a psychiatry, you'll be doing it all the time or forever. It can be just because of the stress factor. Yes.
Correct. In the process,
there's another question.
In the process, you are taught coping mechanisms, which in the future you can also use. Di nakakinahanglan mo adto sa psychiatrist sa kaduha. Nakabaon magkaunsaon imong abilidad. Okay, go ahead, John.
There's another question, Doctora. How do you deal with feelings of anger and frustration towards your family members and relatives who willingly disobey social distancing and quarantine rules, knowing that they might infect you and others of the family?
ana gani, you are becoming angry and frustrated.
Frustrated. Yes.
Frustrated, nya hadlo ka nga gisulti nimo murag kanang makuntrahan ka, you know, you try to change your demeanor, meaning act that you are serious. Ani maskin imong ina nga tempa kini bitaw kan kinahanglan sigud tag meeting anida. Yamin sa di mo mag-meeting. No, I just want tagay lang ko ninyo, maski 10 minutes lang, let's talk about it. Kay I will be amiss. Always start with yourself. Do not say kamo do na mo isa. Ing na ako, I will be amiss. Dili ko mahimutang kay dunay kuwangan nga dili ko makikistorya ninyo bahin aning akong kaadman regarding what I know. So you talk to them and then you sit down and you know my children, they know that in English lah. So nanap pumisaan ni ay kay I always tell them when they were younger, kartiwa, nakatguan man sila. Maingon ko nila, could I have an appointment with you in your room? Mag-argue na sila kay, ugmantin ko silang room, makigistorya man ko nilang tarong. Hindi mo ko mga saba. Istorya lang. And it would be nice for parents to do that to their children too.
Communication. It is
Communication. Unya paminaw gyud sa ila. Ayaw gyud na ako'y danay nimo, ako'y tatay nimo, ayaw kong tudlo ha, kay naguna ko nimo. Di gyud na mada, inana gani mo, wa gyud batang musulti ninyo.
True. Yes, communication is a two-way. It's not one way. So you communicate.
Yes.
Listen. Another doctora, how you let the patients cope up when you say that their deceased loved one will be cremated 12 hours wake only. So I think
I-explain po na. I-explain sa ila. Nga dunay balaod. Nga na ay balaod. Unya ang unsa po'y advantage sa balaod.
True.
Advantage sa balaod, na ay balaod. Unya kanang for example, there could be some religious interpretation, no? Kaya sa Catholic Church sa una, ang cremation di man gyud allowed. Pero karon di naman na mao. So we just explain. Unya panalitan na agad sila extreme kanang denial or extreme against nila ana. You talk to them. Why? Where is it coming from? Because that's the only way you could help if you know what they are thinking.
Okay. Thank you, Doctor. As we wait for another question, we will just share this the study that we had with Dr. El Ray Inoshan, our second-year resident. Yes, and then we co-authored it, Doctora. And then probably you can comment on the results. So this is about the mental health and coping strategies of Filipino healthcare worker. This is in Perpetual Succor Hospital. We determine the mental health of our workers and then coping strategies. This is through a cross-sectional descriptive survey, online platform in our hospital, and a standardized question just recently. And we thank for all those who responders. We have about 215 responders, 90% retrieval rate. So majority is actually around 34 to 44 years old. You know? So, and then there are representations of all healthcare workers, and then doctors, nurses, and medtechs, and all the paramedical personnels. No? Usual, most of the experience is 1 to 3. And here, and the area is distributed all over. Then it's around 5% of these responders are from the COVID triads, and 9% in the COVID ward ICUs. Even if these are the only ones assigned to these areas, there are about 69% of the responders said that they have handled COVID-19 suspects and probable confirmed cases. We also asked the question of the discrimination. So 28% felt they experienced discrimination either in the community. But again, there are about 81% who experience appreciation of their work as healthcare workers. That's good.
Good. Yes, very good.
And the feelings of healthcare worker during COVID-19 pandemic, no? These are the top, I think, that 8, no? They felt nervous and scared, and although they felt this, they feel that these are their job, and it was their professional and ethical duty, no, to do this. So they continue doing it. They think of quitting their job. 50% actually wanted to probably think on one way or another that they can quit their job. They would quit their job again, 25%, one-fourth of them says they would quit their job on COVID-19 recurred. But however, it is good to think that none of them actually thought of calling sick, and only around 18% called sick at once. So this will show you. What will you comment on this, Doctora?
Well, I'm very happy with the result, because it seems like, we have dedicated staff, and they seem to be coping okay. Not all of them, but in general, they are coping okay. And I'm really thankful for the job of Ray, you, and I think Charles, no, has also Charles.
Yes, Charles. Yes.
Yes.
This is the causes of stress. These are the causes of stress of.
Yeah.
Okay, doctor.
You notice it, that not knowing when the COVID-19 outbreak will be under control is the 98% answer yes. The uncertainty is there. But that is not anything different from what the rest of the world is feeling. And there's the fear of infection of loved one. It's also there. No? What man the way we are responding is not anything that is out of what is general feelings regarding the COVID crisis with healthcare workers. Kanang seeing each other stressed or afraid, common man yung kayo feeling. Ang diferensya lang sa Filipino o sa mga puti or those outside of the country, mas kuan man gud sila, mas dili kay sila magkig-istorya, mas kinakita na silang naglisod tong usa. In fact, if you notice, ang Filipinos, kung naunag yung nakita nga manghatag og pagkaon, were the Filipinos. Mo share bitaw sa pagkaon sa mga healthcare workers. Naabot naman na sa Amerika ron. Dako kayo dako kayong tabang nga ginabuhat na.
Yeah, feeling of being appreciated is also very important.
Maunang ingon nila nga. Yes, you are entitled to appreciation, but do not go beyond caring yourself. Mao lang na di ko anatong article kagapon or 2 days ago. 2 days ago, right? Kagapon mo kung basahan. Na do not be taken into into the obligatory thing because you are being appreciated. Okay na. They should appreciate what the healthcare workers are doing. We are really keeping the world together and sane.
True.
Yeah.
Another thing, there's a table on factors that help in reducing stress among our healthcare workers, and this is what they listed.
Okay, so even kanang colleagues in your department, kay force man pareha inyong agian. So there will be an understanding of each other's feelings.
So this is something very important, no? For us, our chairman and training officers of the different departments.
Yes.
A positive attitude from colleagues in your department is 98% a factor of reducing stress among our health.
Yes.
So we have to give them the place for them to have reduced stress. No?
Yeah.
So I think that's how we will deal. Initially, we did what we call for the residents to cope up initially with the COVID is to do them in skeletal duties, make them certain time off, and then until such time that they were able to cope up with the stress, and then we introduce again some of the training requirements that we do. And I think we have to not to forget this, no, the positive attitude among colleagues.
Ang akong
and that is 98%.
Nakakatsa sa mga is sharing jokes or humor among colleagues. Maayo man kita inom-himog komedya. Amin lapat it. Ako mo katawa man gyud ko kay magkakita ko na ini biswa da mo. Hindi ko kalipay punta ni da kan kahat nakakatawa tarong adlaw. Yeah, we have a very
The
good
other one, Doctor, clear guidelines from hospital for infection control or prevention. That's 94%.
Mao. Monang I
And
said,
then
we have to thank our committee on infectious disease.
Yes. Getting free meals. Now, Doctora, from the unit. Mother Zeta, thank you for that. 86% says this reduces their stress.
Correct.
Can you comment on this?
Oh, very good guy. Unknown to probably some of the residents or people here, I have friends. I tell them not to mention my name. I have friends who are giving free snacks to our staff without mentioning my name. I have asked them help and said, padana nga to kay kinahanglan na. So sometimes mingon gud sila sa ako, Duk, dakhalan kay mi pagkaon ron. O sa po sila, wa man mi pagkaon ron. So ako na to, tawag maghatag og pagkaon niya. Wa na ko sila pagkaon nito ay. Yeah.
I think it's not only the pagkaon.
Oh.
Yeah, dili sa ang pagkaon, Doktora. It's a feeling of being appreciated. By the administration. Yeah. True.
Well, the administration, I really salute them because it's just that as leadership, it has really been really very, very gracious, I think Sister Zeta has shown a lot of, sige lang nag-ingon, wa naman ko'y kwarta, unyag na nagani pangayoon na natin kwarta. Nako, ikaw ba Sister Zeta, ningon ka, wa kay kwarta, unyag, the same ka nang, same nga ko, may ka, hala, ningon naman ko ato, unsa man niday? Sige, kaya ningon naman ka, tagaan, di tagaan.
Yeah. Totally agree.
I love Sister Zeta. Yeah.
Yeah, we love her. So, yeah, all of us.
Yes.
Totally agree what you said, Doctora. Another thing is personal coping strategies of our healthcare to alleviate stress.
Mayo ka mo. 56%. Ang ilang do relaxation activities?
Chatted with family and friends. Try to be busy at home and would keep your mind from COVID. That's true.
Yeah.
This is like making a routine that is outside of COVID. So that's
Arnold, what I told Ray, I said, Ray, try to get the feedback from other residents of other hospitals and apparently many na di ay nag-ingon sa iya. Nga ingon po kay Hadron, ang atong data will be how we in Cebu City healthcare workers are really feeling about this thing. Kay mas dako ang atong coverage, nindot kayo kay makita gyud sa evidence-based gyud nga naay mo ni ilang coping.
True.
Nga ako ingnan nga
I think
kanang other chief residents residents who will join him to make this study.
Yes, we can expand this study.
Very good.
I think this is one of the motivational factors. The one that questioned earlier, why we have a certain resiliency in with stress. 99% is family support.
Yeah. Yes.
So we lean back to our family. And
family ties, as I said, really helps. Dito sa puti, sa outside, wala man. Iya naman. Ila man ang culture. Di sa ta maka-hinaway, kaya ila man ang nadagdan. Agi.
So sometimes they say financial recognition of efforts or even just recognition from management and supervisor for extra efforts is 95%.
Yes. Yeah.
So, is there any other questions, India? And before that, we also wanted to ask acknowledge the attendees, of course, our dear SPC sisters and Mother Zeta Rivero, who is also within our audience, Doctora. And Charles Tan, Dr. Charles Tan, one of the persons who actually made this
Ibalik
event
na ko.
possible.
Karon?
Yes. Charles, can you ask, you have any other question, Charles? And our dear consultants from all departments. And then there is a question here, is this possible to share? We hope we can have more of this in the future
Yes.
in some topics. And we are trying to record this and share this. Charles.
No, yes. There's a
Yeah.
question here from, to whom or where do we refer our anxious, depressed patients or family members now who needs medical management and treatment?
Okay, I would like to inform everyone that there are 4 psychiatrists that are in our staff in internal medicine. Aside from me, there is Dr. Glenda Basubas, Dr. Mendoza, Mendoza, say first name, Dr. Emma Mendoza, and Dr. Fe Costales. So, and myself. There are 4 psychiatrists. You can choose either of those. Upat ka psychiatrist na sa kaning atong staff gyud sa internal medicine. And all of them are board certified. All of them are board certified.
Okay. Thank you, Doctor.
Okay.
Charles, any other question, Charles? Chuck Tan?
Noel, can we just go back to the last slide of Dr. Onyate? Apparently, she wants to tell us something on her last slide.
Okay.
Kani? Okay. The last slide that I gave is a reminder to all of us, no? You know, there are, as I have said, that there are people who do not understand the work of our health workers, and we notice that some of them will shout, will throw stones, which is not right. And I would like to remind all of us that I have a slide that I saw which says, "Dear haters, I could not help but notice that awesome, the word awesome ends with me, M-E, and ugly starts with you." So, mauna, dili lang na, saon ta man hindi man ta makapalipay sa tanan. Pero kadaghanan, as we noticed, appreciated our job. And that is more than enough. That 90+% feels that, which is good. And that is good because this is culture of Perpetual Soccer Hospital as one family. Mao gina akong hope nga ang kita sa Perpetual Soccer, usa kita ka pamilya ug lipayon ta sa usag-usa. Okay.
You have the slides, Jan? You have the slides, Jan?
Oh, yes. Dana, nagawas na.
Okay.
Awa pa ni gawas?
Wala pa.
Exit.
Sorry. Can you do this? Sorry. I have to exit my slides actually, Doctora. Sorry.
Okay.
Nanglan ng mga anteki. Okay.
Pahimat nun lang o pahalipay. By the way, when I did the slides, when I did the lectures, ako nang ipahinungot sa tanang workers din sa Perpetual Soccer Hospital. That's why when I was doing this slide, I was thinking of what we were going through also as the COVID crisis evolved.
Is this the last slides? Dear haters, I couldn't help but notice that awesome ends with me and ugly starts with you. Okay. We also acknowledge the presence of our CME training officer, Dr. Sonida Kamomot, and the CME director, Dr. Loy Tan, and of course, Mother Zeta. Okay. any there's no more questions actually.
Okay, good.
The, do you have any final words, Dr. Oñate?
Yes,
I mean,
I just would like to appreciate what you are doing, Arnold, and also, of course, the couple
Charles.
Stan, Aloy and Chuck. They are really very dedicated to Perpetual Soccer Hospital. I remember very well many years ago. I would like to share this when Charles was appointed in our staff. I talked to him and I asked him. I said, Charles, usa ra gyud akong gihangyo ni Charles. Ayaw gyud biyahe ang Perpetual Soccer. Abi nimo kung sa gitubag ni Charles, ingon si Charles na biyaan ako tanan dok ang ug gusto ka dinhi ra gyud ko. Na ako niingon, ayaw po kay. You are still starting a family. You have to do what is your capability. But I really appreciate what Charles said that and still has proven that he's doing that. So thank you for all of you for being really in Perpetual Soccer and being part of the Perpetual Soccer family. Kauban
Thank
yun
you.
ta sa trabaho. Kauban ta tanan sa trabaho. Tanan kamong naa sa committee, pasalamat pug dako. Of course, silang Sister Seta o ang mga madre, dako kaayo o katabang sa nganong naingon ani ang atong culture sa Perpetual Soccer Hospital. So God be with us and peace be with you.
Thank you. And we will also have the final words also from Mother Zeta Rivero for to close this webinar. Mother?
Thank you, John. This is quite an anticlimax after listening to a very interesting speaker. But I think I have to share you this about my own feelings. To all of you who are here participating in this Zoom webinar, thank you for taking time to be with us. We are all in awe and amazed listening to Dr. Puresa Oñate, an international expert in the realm of psychiatry. We feel proud that she belongs to us, being our medical director. Uri, thanks so much for reaching out to us by addressing our issues. The survey is very interesting. It is a very affirming one, but at the same time, it opens my eyes to what still I can do for the needs of all of you. So you address our issues, be it psychological or otherwise. We are besieged by unexplained fears and anxieties. As you were having the conference, I can feel my heartbeat, no? Because I too have experienced all of this, especially somatization. The more I see things on TV or YouTube, the more I can feel that I have the symptoms. We can see our enemy, and so our responses of protecting ourselves and our loved ones seem to be very minimal. Even ours as administration in protecting you. Not any one of us expected such a deadly disease to strike and linger for months. And so we pray, myself, Lord, when will this end? I am not surprised, so I knew normal is the term we are using now. Yes, it's normal, but new. The effects of coronavirus are tremendous, not only to us here in PSH, especially our sick brothers and sisters, those who had passed away and may their souls rest in peace. Our very own Dr. Stud, Helen and Dennis Tudtud. To our caregivers and frontliners, but for the whole country and the world as well, it is indeed pandemic. It makes the world a lot smaller since we are connected closely because we have something in common, connecting one to the other, the coronavirus. We, the Sisters of St. Paul of Chartres in this administration, who take care of you and the needs of the hospital, have the bigger responsibility. Because of our concern for you and that of our patients. I am still very lucky, though, I told myself, and during these uh, days, months that I'm always alone with my thoughts, I often go back to the positive things I have heard. I am still very lucky though because our doctors here in PSH, yes, doctors, I do
Yeah.
appreciate you. Fellows, residents, staff, and personnel are the most determined, committed, and selfless individuals, always working as a team. Most often, our consultants will tell me, Mother, we are all in this together, and we are one in this, Mother. Every time I remember those words, I am touched and very much strengthened, and my fears disappear for a moment. I would like to acknowledge the two gentlemen doctors here who are our prime movers of this psychological first aid, PFA. And let us congratulate Dr. Charles Tan and Dr. Arnold John Ozon. I call him John only, who are spearheading the program. It is so noble a purpose to be of help to others, to console and bring hope. When this was mentioned to me by Dr. Charleston and later on Dr. Arnold John joined, I said to myself, wow, what a selfless endeavor to venture into this by these two young doctors in order to reach out to those who need psychological help. I was overwhelmed and I said, yes, I will support our project. Just present to me the program. I think, Puri, we are the first hospital in Cebu to have pioneered this
Yeah.
program.
Yes.
Thank you so much, Puri. Thank you so much from the bottom of my heart.
Yeah.
Again, my heartfelt congratulations. This is indeed very timely because each one of us is feeling overwhelmed with emotions like sadness, of course, our families, depression, worries, and anxieties. We will try our best as administration to respond to these needs the most we can. But remember, we too have various needs to attend to personally and as your leaders in the organization. This is, in a way, don't limit our concerns and support. I want you to know that we feel the same emotions, which are overwhelming. What strengthened me and the sisters are prayers, prayers, and more prayers for each one of you in our patients. I personally also experience what you are experiencing, being gripped by fears, anxieties, and a strong sense of desolation. Human as we are, sometimes we cry and languish. There seems to be no answer. Why, Lord? But we hung on to faith and trust in the Lord. At this point, I can only say this. We will have to work in unity together to conquer our fears, our anxieties, feelings of social isolation, pains, doubts. I will move the whole PSH family and community to respond to our needs. We are a family, so we bond together. Let us help and take care of each other, our families, and of course, the poor in our midst. I say this again. I am grateful to each one of you for your self sacrifices in taking care of our COVID and non COVID patients. It is a risk, I know. But if we are not there, who will? God bless you and protect you. Let us then not lose faith. The Lord listens to the cry of the poor, our cries. Let us continue to beg His healing mercy and forgiveness. Let us beg the Father to keep us strong and steadfast. Let not our faith and trust waver. I say, Lord Jesus, be with us in our midst to heal and be forgiven. Please whisper to the Holy Spirit, to end our sufferings. Please bless our family, our own families as our Mother of Perpetual Succor. Intercede to Jesus for us. Keep us safe and well. Last, this is the promise of Jesus before he ascended to heaven. It will happen on Sunday. He said, "Your sorrows and griefs will all turn to joy. Do not be worried and upset." John 14:1. Jesus said, "Believe in God and believe also in me. Don't let your hearts be troubled. Trust it. Trust in God. We believe in your words, Lord Jesus. God bless Perpetual Soccer Hospital, our families, and each one of us. Thank you very much.
Thank you, Mother. Thank you, Sister
you.
Zeta. Thank you very much for these encouraging words. Um, as we end our webinar, we go back to what is said by Dr. Onyate, that it is okay to be anxious at times, and we should establish certain coping strategies that is very relevant to us. We should acknowledge if we or our fellow healthcare worker further need help, medical help, and acknowledge this, and we should seek if it is necessary. We protect ourselves first. There's no way that we can actually help others. We will not protect ourselves. And then do not blame ourselves. There are people, there are things that we cannot control. They say we have to know and get the wisdom which we cannot change, and have the strength that we can change. So protects ourselves first, and of course we pray. We have established a family support, and these are the things that we need to do as healthcare workers. Thank you very much for participating in this webinar, and we hope that we will have it more soon, and if the need arises again. Thank you, Dr. Puresa Trinidad Onyate.